Hello, and welcome to the Texas Mind Exchange podcast. I am your host, Cody Gould. Today, we were honored to be joined by Alyssa Ramirez from the American Red Cross. The conversation that we had today was about resilience and mental health in Central Texas. We covered topics such as the 3 H's of housing, hunger, and health. And we also talked about how they're incorporating local mental health organizations into all of the work that they do. So without further ado, welcome to the Texas Mind Exchange. Well, thank you for joining us. The place I want to begin is when I think of the American Red Cross, I typically don't think of mental health. And I know that that's like one of the more initiatives that you work towards. And I guess I would love to start off talking through kind of the American Red Cross and mental health initiatives that you work on, specifically in Hays County, and we can kind of go from there.
Yeah. So I'll start with kind of giving just a broad overview of what the Red Cross does in terms of mental health during disasters, if that's okay. So we have mental health volunteers that are all mental health professionals. They usually all have a master's degree or higher and are certified to practice. And so we try to recruit as many of those people as we can. And mental health services for the American Red Cross that began in 1992. So the organization really realized even back then the importance of mental health when people are dealing with disasters. And so just a few numbers. Last year in 2024, over 500 disaster mental health volunteers were deployed. And so that's quite a big number. And there were over 23,000 disaster mental health contacts following medium to large scale disasters last year. And so what we see is, during a disaster, there are lots of things that can happen, right? People get displaced from their homes and they can lose, most, if not all, of their belongings sometimes. And it just really takes a large toll on a person's mental health. And so there are different kind of junctures where the Red Cross will kind of step in to provide support. And so that is during sheltering. If people, if a community has to go into a shelter, we have volunteers that work in that space. And then we also have volunteers that follow up, for that long-term transitioning, especially if people have lost their homes and they need, that support, not just right after a disaster, right? That long-term recovery. And so what we have seen as an organization, unfortunately, is that the number of billion-dollar disasters, natural disasters that are occurring in the United States are happening more frequently. And a lot of times, the same communities are getting hit over and over again with these disasters, right? And the Red Cross has really tried to understand what approach would be better to create a more resilient communities. And the program that I am a part of is called the Community Adaptation Program. And it is a relatively new initiative with the organization, started about 2.5 years ago. And what the Red Cross does is they took like a blanket look at the United States, right? And kind of decided that there were these areas that had frequent disasters. And so they decided that they were going to form these teams. They were 3-person teams for specific counties. And there are some criteria there as to which counties are chosen. The population has to be over 50,000 and below 250,000. They're usually in between 2 big metro areas, which typically causes, these smaller communities to not get as many resources during a disaster. And so the intersections that we are looking at to help build these resilient communities are housing, hunger, and health, both physical health and mental health. And that is the lane that I am in specifically for Hays County. And so with our team began last year. We're one of the newest teams in the United States. There are currently 18 counties with a community adaptation program team in them. And so, some of these areas are places like Florida, where this past hurricane season, we have seen, devastating loss there. And then also in California, there are a couple teams in California that have been dealing with an array of disasters over the past, 6 months to a year. So our focus, we are investing in hyperlocal organizations, nonprofit organizations that are doing work in those, what we call our 3 H's, housing, hunger, and health. And our team, each team works a little bit differently, but our team has decided based on our skills and our expertise to each take on one of the H's. And so my background is in public health, and that is why health is kind of my lane. And what we have seen from talking to people in the community is that no matter where in Hays County we are at, no matter what type of organization we are speaking to, one common theme that everyone has kind of said that they would like to see more of or need more support in is mental health. Mm. And so we are focusing on bringing organizations into the county, expanding the capacities of existing organizations that provide mental health resources.
Wow. Yeah. And you said earlier about working with other organizations or investing in other organizations. And I know that a lot of people who work with the Translational Health Research Center here on campus might want to get involved with that. So could you give us a little bit of background about what type of organizations you work with and how you might begin to work with them?
Yeah, absolutely. So when each CAP team launches, we have a 90-day discovery period, is what we call to build our launch strategy. And so in that time, we do a lot of research in the community about, looking at what organizations exist, what programs do they offer. And one main component of the community adaptation program is that the Red Cross really is focused on hiring locally. And so hiring people that know the community, that are of the community, right? And so I live here in San Marcos, and, being involved in the community is one way to understand what organizations are doing the work. But we have also, with our partner organizations that we have identified, we have hosted community listening sessions. And so this idea is, these organizations, whether it's a church or another nonprofit, they normally have, different types of events for their community. And so we have build trust with these organizations, and they allow us to come to their events and set up, a table that we have these interactive components to them, right? One is a risk scale, asking people how prepared they feel about different disasters. Another, we have several other questions that we pose. One being, what organizations do you or your family go to for support? That question has really helped us focus on what organizations are people looking to that we can reach out to support. And so that has been really, really key in our discovery. The other question that we ask is, what is your dream for your community? If money wasn't an option, what is your dream? What is something that you would like to see? And that is really where we see a lot of responses regarding mental health. And so in the fall, we conducted these listening sessions with several community partners and went through and kind of, mapped the data, and we found some recurring themes. And one of those recurring themes was mental health resources.
When we talk about mental health resources, and mental health in general that people might be looking kind of for resources for, what exactly do you think that they're talking about? Like, what does mental health mean for them?
Right. That's a good question. And, we might not necessarily know, right, just to start. And so one thing that our program is doing, one of the organizations, actually two of the organizations we are investing in, one is called Contigo Wellness. They are a mental health nonprofit that focuses on destigmatizing mental health in BIPOC communities. And so they were one of our first enhancement organizations. And what we've done so far is they have a cultural information campaign, public information campaign, where they choose an artist and a location to create a mural that has their tagline, which is "Tú importas," which means "you matter" in Spanish. And that mural is at 201 South LBJ. And not only does it show and pay tribute to the local indigenous community, the local landscape, there's also a QR code permanently on the mural that links you straight to Contigo Wellness so that you can search for resources, any type of resources that you might need. And with that, they are going to be bringing in wellness workshops throughout different areas in the county. And so this month is Women's Month. And we are planning the first women's wellness workshop here in San Marcos to be hosted at our other partner site, Centro Hispano. And so that is one way that we are trying to get different organizations involved together to really amplify the message and the resources. And another thing that I'll mention specifically about Contigo Wellness is that, it is geared towards BIPOC communities, right? And so they take into consideration other modalities of healing, not just the traditional, therapy, talk therapy, which is great, but they really bring awareness to other types of resources. And so that's really what we are going to try out. This is new to Hays County. And we're going to host these workshops and see what the feedback is, and then see how we can expand on that.
Yeah, that's amazing. I think that kind of also clearly connects what you were mentioning earlier of resilience and identifying how to amplify resilience within a community. And maybe there's not a blueprint on how to do that, but working with an organization like Contigo Wellness or other organizations that take alternative ways of looking at mental health and trying to fold that in to recover from things like different types of crises or pressures that are kind of on the community in general. Which leads me to ask, going back to crises and building resilience, I know you mentioned like big natural disasters. What are other different types of what I guess defines what a crisis or a crisis is, so that the Red Cross can go respond to it? Is there an amount of people, or what does that look like?
Yeah, that's a really good question too. So of course, yes, our natural disasters, but there are other things that can happen in communities, right? For instance, some of these recent plane crashes that have happened in the United States, those are some events that we respond to. And it could be, different types of community events. Unfortunately, school shootings are a reality in today's society. And so something like that could also be an event that we are called in to respond to. And so it really, there really is a full array of things that could happen. And a lot of times we're not really set on what it is that we come to help with, right? It's if the county needs support and they call on us, right? Or if a certain community is having a need, we're there to step in.
Gotcha. Yeah, I think that that's something that, at least me personally, I overlook that. Like, I think of the wildfires in California and think about responding to that. But unfortunately, I know that we've had like school shootings or shootings at, other large gatherings here in Texas and the surrounding areas. And I think that's something that personally I might overlook. Like, oh yeah, that is a disaster and a crisis that we need to respond to with organizations like the Red Cross to not only deal with the immediate response of making sure people are safe and okay, but also what are the repercussions afterwards? How can we make sure that we can build back the community, we can build back the response to be more resilient? And that's just something that I think that personally I took for granted. And I think that maybe some other people are like, oh yeah, like there is no blueprint exactly of what something like that you all might respond to. It can span a bunch of different things. And this leads me to ask more of like a personal question to you, which is, how did you get involved? You were the first person I've ever met that has worked for the Red Cross, which is amazing. And like, what is your specific background and what drew you to this line of work?
Yeah. So I guess we can take it back. Yeah. So I identify as a scientist. So my undergrad is in biology, love science. Always thought that I was going to be a doctor. So I've always been intrigued by the human mind and body. Things changed after college, and I decided to go into education. And so I taught fifth grade science for almost a decade. And that really was kind of my intro to mental health, actually. I coached a program, an after-school program called Girls on the Run. It's actually an international program, but at the time, it was geared for 3rd to 5th grade girls. I think they now have a 6th through 8th grade, but I coached that after school, and the whole premise of that organization is to really connect both the physical and emotional health of young girls, right? In this trying time where they're growing and different things are happening, right? And so it was a curriculum that was part, the emotional part, and then physical, right? We trained for a 5K. And so within that, I met with these group of girls, twice a week after school. And the curriculum really had different things like breath work, like introduction to breath work, meditation, positive self-talk. And there were a lot of sharing between, me and the girls of just different things that they were going through. And it was at that time when I really realized, like, wow, these kids are really going through some serious things that even I, as a kid, I was never thinking about these types of things, right? And that really showed me that even at such a young age, mental health was so important, if not most important at that time, right? To get a strong footing into becoming an adult, right? Becoming a young woman. And so through the years of teaching, I continue to see, the challenges of my students, the challenges of my families, my own challenges as a single mother at the time. And that's when I decided, and at the time I didn't know it was all these social determinants of health, right? That were really stacking the odds against these families. And I realized, although I love teaching and I feel like I will always be a teacher of some sort in some capacity, that really I could have a bigger impact outside of the classroom. And so that's when I decided to resign and go back to school to get my master's in public health. That kind of seems like the avenue that could really encompass everything that I was feeling that I wanted to do. And so that was in 2019. 2020 comes around. We all know what happened then. And that really took me on this new journey of disaster response. Although again, at that time, we weren't calling it that really, and so I worked in that space, from the beginning of the pandemic through, 2022 pretty much. And there were a lot, as people were dealing with this, with COVID, and everything that followed, right? The loss of jobs, right? Struggling to make ends meet, finding food, masks, all of the things. And we really saw communities suffer in their mental health, right? And having a young child and having him, be at home for school, seeing the social aspects of, just him growing in this weird confined, area, it really, it took a toll on me and on everyone really. And that's when it was, early 2021 when I had been doing work out in the community. And that's where I met the founder of Contigo Wellness. And they were just starting really the organization. And I got to a point where, I really thought, I need to talk to someone. It was nothing I had ever done before. But I really felt that I needed something. And so through the Contigo Wellness website, that at that time, it was just like a list. I wouldn't say just, it was a list of providers that were BIPOC women, all of the things. There was variety there. And so I went through and I found a therapist, and it completely changed my life. And that is no exaggeration at all. And so that was early 2021. Fast forward about 9 or 10 months towards the end of 2021. And that is when we got the devastating news that my mother had stage 4 cancer. And it was only 6 weeks from diagnosis until she passed. And then a couple of months after that, my father, whom they had been together since they were 17 years old, they were both super extremely healthy, so that it was all a shock, but he got COVID, unfortunately, in February of that next year, and then passed away in April, so less than 4 months. And they were both gone. And, in that entire time, my therapy practice was something that I never skipped on. And there were multiple times throughout, that year when I was going twice a week, every week. And I really, the support and the tools that my therapist was able to provide me really saved my life. I don't know what I would have done in that time if I didn't have that experience, if I didn't have those tools in my toolbox. And, since then, it's really been, top of my mind in my advocacy and in my work. And so I don't think I ever answered how I got to the Red Cross. But again, and this is just a beautiful testament to collaborative work also, is that during COVID, there were a group of us that we were a collaborative, and we were doing this work, COVID work, in different spaces throughout Central Texas. And one of the people leading that charge is actually my now boss. And so when she accepted the position, she called me up and she said, "Hey, I don't know if you're looking for a job, but this is this new thing from the American Red Cross. It is Hays County focused, and it is something that I think you'd be perfect for." And so that's how it happened. And yes, so I started on July 1st of last year, and it has been such a fulfilling ride so far. So
yeah, thank you so much for sharing that story. I think it gives a lot of background that I know that I personally was looking for, but also like it seems to me that the position found you, which is a really cool thing to kind of, I guess, receive, because sometimes I think I used to be a coach way back in the day, like a lacrosse coach, and all of my players would be like, "Well, Cody, how did you find your, the path that you're on?" It's like, you gotta have to try things out, and then something finds you eventually. And I think that your story is a testament to that, of just like, you kind of grassroots worked your way into the position that you're currently in now, supporting a community from a perspective that hasn't been done before. And that's really, really cool. And it gets a testament to the person that you are, which is amazing. That grassrootsness about how things kind of bubble up from necessity, whether that be that the American Red Cross is now responding to mental health because it's such an important piece, I guess, of wellness. When we think about that, and specifically Hays County, are there specific challenges in this county, kind of being sandwiched in between Travis and Bexar County, that we focus on here that might be different than those two counties? Or are the kind of the issues and the problems that you might be seeing relatively similar to those larger metroplexes?
I think it is different, just being, a smaller area. Again, really sandwiched between Austin and San Antonio. Those are the big, cities that get a lot of attention. What I would say from my experience here is, we have a high Hispanic population, and I feel like as this explosive growth has happened in Hays County, that sometimes those groups are getting left behind. And it's infrastructure, right? But it's also accessibility, right? Support for these smaller organizations. And that's really, I think, fundamentally, and everyone will say funding, right? But it is true, especially when we've got these bigger organizations that have staff, that have grant writers, right, that are well-versed in these things, versus these smaller organizations like we see in Hays County that are bootstrapping it, right, that maybe don't have the capacity to have staff that are full-time, or that have these different qualifications to help, expand their work. And so that's really what our program is trying to do, right? That is the main charge of why we exist, and what we're trying to accomplish is bringing support to these organizations to help them continue their mission and do what they want to do.
Yeah, because at least something that we're seeing, like part of what we do at Translational Health Research Center is identify some of these organizations, and we post them onto a website called The Central State around different events or organizations that are helping out community. And I think exactly what you're saying is like, yes, of course, funding is a necessity, but also like, how can we give attention and resources to these different initiatives and organizations so that they don't run out of things to do or people to help or awareness that will help them perpetuate forward. Of course, yes, donating is important, but also how can we help each other? And it seems to be like the through line that I hear from you is that it's everything that you do is about bringing community, bringing people together, which is amazing.
Yeah. And I think to that point, and it's something that I studied in graduate school actually, is just connecting the groups together, right? Everyone is, passionate about their mission, passionate about the community that they serve. And sometimes that kind of creates this silo effect, right? And where there is a gap in one organization, there might be another organization that can fill that gap, but we're just not aware because, everyone's grinding their own grind, right? And that is something that we are seeing just already with the one meeting that we've had that we're calling our Hayes Resilient Network. And that's just bringing the organizations that we partner with and potential partners. We brought them together in a room. We, showed them some resources, had some interaction with each other. And from that already, these different organizations within Hayes County have supported each other during the cold snap. And even just the other day with some of the fires that sprung up. And so really being that bridge, and a lot of that doesn't take a lot of money, right? Or we're not having to come up with money or funds for other resources because these organizations each individually have them, right? And so just bringing them together, I think, is really important.
Yeah. Talking about that network a little bit more, how do organizations get involved? Is it mostly just you reach out to them, like you wait to hear their name being brought up in maybe one of those listening sessions, or do they reach out to you? Do you reach out to them? What does that look like? How did you create that?
Yeah, it's kind of a combination of all of those things. I think that originally, we kind of have this list that, we kind of worked off of. The community listening sessions, definitely. I think every organization pretty much that we can partner with, from those listening sessions, I think they're either assigned, MOU partner already or in the pipeline. And then we try to get out to as many meetings, coalition meetings, or there is this wonderful group called the Hayes Interagency that a lot of groups, a lot of nonprofits are a part of. And so we're just trying to figure out where those opportunities are and go and introduce ourselves and kind of go from there. But yes, organizations can reach out to either one of us. There are 3 of us. And so, yeah, we just are really trying to get out there and see what orgs are doing this work and who's everyone kind of talking about.
Yeah, that sounds great. That leads me to think do you have much interaction with surrounding counties as well? Because I know you mentioned those 18 counties earlier, or were they kind of areas? I might have blanked on that, but what does that, I guess, cross collaboration look like if it exists between like here and Caldwell County or Comal County, or maybe some of the counties that are in between Travis and Bexar County? Does that exist?
That's good question. So we are Hayes County focused. So our funding and everything that we are doing is strictly in Hayes. And that will be for so every team is in their county for 2 years. That doesn't mean after 2 years we leave and abandon them. That just means that's our funding pool for those 2 years. And so we've kind of got that timeline to build this network, to support these local organizations. And so eventually, after the 2 years, we'll kind of step back and in theory, everything will run smoothly because the partners are all taking care of it. After that, and this has been a big talk in our organization because some of the first teams to come online are now going through what we call our regional integration. So the Red Cross we have the entire United States. There is a Red Cross chapter region. And so the plan is, and again, our program is new, so it's all, kind of a pilot. But the teams, the oldest teams are now integrating into their region. And so that looks like, kind of taking the model from the county that they were in and expanding it to the surrounding counties. And so in the future, that may look like, after we've got about 18 more months or so. And after that, we would integrate into our region and make a plan. Right? Do we go to Caldwell next? Do we go, since there's 3 of us, can we kind of split up? We won't have the same funding pool, but we will have some funding and we will have the experience, right, of how to connect these dots and then potentially bring organizations that we've helped build capacity for here in Hays County. Maybe they'll be able to extend their services to some of the neighboring counties because that kind of already happens.
Yeah. That's one of the big things that we focus on here is when you think of Central Texas, you think of Austin, like we've already talked about Austin, San Antonio, everything kind of in between. But sometimes it's like there is an organization that could help its neighboring county, or people who live in Hays County might work in Travis County, or people who live in Travis County might work in Bexar County, or vice versa, or Caldwell County, or the area is so expansive. So thinking about kind of how you can go out from the area and begin to build is something that I think that it's great that you're looking into because there's such a need for that. And if you're already taking those resources and building from what you've built already, it's like that's kind of like it makes a lot of sense. And I think that here, like as we talk about this and as we think about this kind of leads me to transition to talking about like challenges that you're seeing. Like you've been in this role for just about a year, closing on a year. And this initiative seems to be going really well. On one end of the spectrum, like what are some of the challenges that you might have been experiencing as it pertains to like getting the American Red Cross name out there or more help or things along those lines? Where does that lie?
So I think just awareness, right? Awareness and access. That's what I was talking about, the shifting of the mindset of what the American Red Cross does, right? Instead of everyone thinking that we just come in a disaster, do our thing, and then leave, is really a mindset that we're trying to get away from, right? We really want to be transforming communities. And so being present and being in the community and showing, everyone that, hey, we're here and we want to help. And it's not just during gray skies that we're available to you, right? And so I think the major thing impeding that mindset is just the way people think about the Red Cross. And that's just going to take time for us to show what our initiatives are doing, right? What the community adaptation program brings to the table and how that can really help build resilience during blue skies and when there is something happening.
Yeah, because when I think of the American Red Cross, as I might have mentioned earlier, mental health was not the first thing that came to mind. It more was like, I think of you guys. There's an American Red Cross boat, right, that responds to different crises that are on the coast. Does that make sense to you? Maybe not. I don't know. I grew up on the East Coast, and I feel like I remember seeing a boat with a big Red Cross on it. My dad telling me that was the American Red Cross, like disaster response boat. And in my head, that's what I think the American Red Cross is. Like there's some doctors and they might, go respond to people somewhere. But as it pertains to like a community response, because now everything seems to be going more kind of on the micro level, like responding to the community rather than federally responding. Obviously it makes sense that you like, not only is it like, hey, are these people, are they good? Are they like physically okay? Great, that's fine. But like, are they mentally okay? And from there, how like shifting somebody's mindset on, like, I guess, rebranding yourself, that's got to be a difficult thing to do, because once people kind of get that in their mind of like, oh, the American Red Cross, why would they ever help me? I'm not in a federal crisis or a United States wide crisis. But now, you're gonna have to begin to change that. So, I guess, how are you beginning to change that narrative around your specific role or around the Red Cross in general?
Yeah. So one thing is that we're already seeing the benefits of having the community adaptation program when it comes to these large-scale disasters. So, for instance, in Florida, my boss went and responded to Hurricane Milton, and then I went not long after her to Hurricane Helene to help with Hurricane Helene, because they were back-to-back hurricanes that hit Florida. And so we were working and helping support our Sarasota County team, and that area got hit pretty hard. And so what we saw there were the organizations that were partnered with the community adaptation program. They were able to respond quicker, right? And one thing that you brought up was, in a federally declared disaster, a lot of people think American Red Cross is a government entity, and we're not. We're a nonprofit organization. We do work side by side with a lot of, local, county, state officials, but we are a nonprofit organization. And with our partners, part of building that resilience is that they are able to activate when they see fit. Right? They don't have to wait for a call from the city, a call from the county, or, directive from the federal government, because they are using the resources that they have or the resources that our program has provided for them. And they are able to say, our community needs a place to come and charge their phone and get something to eat and take a shower in our shower trailer or whatever that might be. And so they're able to activate and be there as soon as, the need arises. And so that has really, and it helps really save everybody money and resources. And if we have people that are responding locally, then that cuts down, resources or people that we have to bring in, right? And so what we've seen is that this has been working really well in areas that have undergone some, pretty major disasters lately, where CAT teams are in place. The other thing I will say too is that we've had to think about, like I mentioned earlier, our CAT teams are hired locally, right? It's really important that the people in our team are from the community and know the community. So that also means that they will be affected a lot of times during a time of disaster, right? And so what we do is, that's why our team, right, we weren't in a disaster at that time. So we were able to deploy to go and help and support them. And so that is kind of the model that our program is taking with that approach. And we've really seen lately how important that is, because the team members are dealing with their own mental health, right? Their own losses. And so it's really important to have us in other parts of the nation able to respond and support them.
Yeah. When you say CAP team, what exactly is CAP team?
Yes. So that is the Community Adaptation Program. And so we are teams of 3. So there is 1 manager and 2 coordinators for each team. And so we have currently 18 teams in the United States.
Got it. Okay.
Yes. So those are 18 counties that have a team like ours.
Got it. And there's this theme that I feel like was brought up a few times, which is on one end of the spectrum, kind of preparing a response, but also on the other end of the spectrum, really kind of upholding, I guess, like a good way of working currently, regards to let me start over. What I hear from you is kind of like a twofold situation that the American Red Cross deals with. On one end, it's responding to a current crisis that's happening right now. And on another end, it's how can we prepare people to be ready to respond when a crisis happens? Has that change been relatively new, or has it always been more of like, let's prepare for the worst, and then when the worst happens, we're ready to go? Or is it, we're going to wait for that hurricane to come, and then we're going to go after it? Does that make sense?
Yeah. And really, I think that is where our program was born, right? Saying that they've recognized that just coming in after isn't enough, especially with these vulnerable communities that are just at a high risk for disaster.
Watching in my head, my brain works in metaphors. So it's like somebody watching a TV and seeing that, or like a literal hurricane is about to, hit the coast of Florida or hit Houston or something along those lines. And the American Red Cross seeing that and be like, great, we're going to deploy to go there right now. Compared to what you talked about earlier, like the blue sky-ness of things. Whereas everything's fine. People are going to school. Everything's working fine. But then you come in and you're informing people about saying, everything's fine right now. But at some point, there's a chance that it won't be. And that's why I'm here, so you get to, understand who I am and how I might be able to help you. Is that I guess my question was, is that initiative was new with this new kind of 18 county CAP team situation? Prior to that, it didn't really exist. Is that right?
Well, what I will say is that there are lots of preparedness programs that the Red Cross has that we, teach. We have youth preparedness programs, right? We do CPR training, AED training, all of that kind of stuff. And so, unfortunately, we are responding to more disasters now than ever, right? And one thing I didn't know before I worked with the Red Cross is 90% of our workforce are volunteers. So when, things happened, they've got to go where the call is, right? Part of our program is really helping to get these preparedness activities more available, right? More frequent in the communities during blue skies, right? So things like CPR training, right? Things like understanding where evacuation routes are, right? We have youth prepared programs called Prepare with Pedro. And those are just, basic for kindergarten through second graders, just to kind of tell them, what happens. It's an interactive sort of presentation, and just to kind of get them thinking about, different types of things that might happen that they need to be prepared for. And so that really is part of what our program wants to do to help, the local regions, right, get the word out and get our communities prepared for things that might happen. Sometimes, unfortunately, because we are deploying so often now, some of those things aren't at the forefront, right, of community. And so that's something that we're trying to help as well.
Yeah. Yeah. Well, I know we're gearing towards the end of our time together, but I would love to ask one last question. And that has to do with whether it's the Red Cross or your specific role. One thing that you're like really proud of and want to like share with us that you've been working on specifically over the past about year.
I think it has been so incredible to see all of these different groups coming together. We hosted our national conference type event here in San Marcos just at the end of February, so just a week ago. And one thing that I was just super proud of, I moderated a panel with some of our partners, and each of our partners are completely different. Their missions are totally different. But we are all together in the same space, wanting the same thing for our community. And I think that now more than ever, that is so important for all of us to really understand what is it that we're trying to accomplish. And differences aside, whatever, how can we all just come together to support the people in our community? Because it all matters to us, right? Whether it's a church, whether it's the VFW, whether it's, a school, right? Whatever it is, everyone has this goal of helping each other, building a stronger community. And that is just something that is really beautiful to see, to come together, and something that I'm really proud of.
Yeah, it's amazing what you've done. If people want to reach out to you or get in contact with you or share some stuff with their organization, what is a good contact form for them to do that through?
Yeah, email is great. Alyssa.ramirez3@redcross.org. And then you can always give me a call too, 512-987-9267. And I'd be happy to chat about anything, a potential partnership, collaboration, or anything else.
Great. Alyssa, thanks so much, and we appreciate your time.
Thank you.
This podcast was presented by thecentralstate.com. Thecentralstate.com is a consortium focused on improving resilience in Central Texas by using evidence from research to improve human and community health. This website highlights health and research data by county and opportunities to find funding and resources for mental health programs in our area. Additionally, there are interactive calendars that keep you up to speed regarding what is happening right here in Central Texas.